Okay, so chapter 14 of the ACE 6th edition Certified Personal Trainer textbook. And this is on exercise considerations across the lifespan. In other words, youth all the way to older individuals, right? So older adults. And this is where you got to throw in this unique individual, the pregnant and postpartum um, woman. So everybody else has already been covered, right? So in the previous chapters, now what we're doing is kind of hitting on those folks who we left out. But the IFT training model works and is utilized in all of these different populations. But there are some, very clear important considerations. Now we talked about in chapter 12 individuals that are overweight and obese. Chapter 13 was with chronic illnesses, chronic diseases, and the IFT model works in all those. You just make appropriate modifications that are obviously make sense, are intuitive, and utilize the concept of a client-centered approach to programming, and understand the unique physiological issues that are related to those populations. And we're doing the same thing in chapter 14. We're going to start off with youth, right? Exercise in youth. So pre-adolescence, adolescence. And what are the guidelines for youth? And there are guidelines, and there are some unique training issues you've got to consider, obviously, when you're dealing with kids. And then how do you apply the integrated fitness training model to youth that you're training? Then, of course, exercise for women during pregnancy, and then after pregnancy or postpartum period. And just keep in mind that there's some interesting, unique issues that go along with training women that are pregnant, depending on how their physician's obstetrician looks at it. They may suggest training all the way up to a certain time period, or stopping at certain. You always go by what their physician says or recommends. um, and then exercise for the older folks. And what's happening when people get older? What are the physiological changes that age brings along with it? And there are a number of them that need to be considered, obviously, when we're training folks. So each one of these particular areas is going to speak directly to the application of the IFT model to that particular age group. So exercise in youth, go ahead and get started on this. There are a number of issues now. Okay, there's a lot of problems with physical activity and nutrition with our youth. We know that. Question is how do we deal with it? I will say that the one word that's going to stick out whenever you're dealing with youth in particular, not youth athletes, but just youth in general, particularly apparently the average youth right now that is generally inactive, is not participating in sports, and is not eating well, is this idea of making things fun and interesting and engaging and kind of playful. That's really what we're looking for when it comes to these particular activities. And so, um, guidelines for youth are going to fall back on what we already know physiologically. Their bones in general have not developed fully. Muscles, neuromuscular facilitation and adaptation has not occurred effectively. So instead of training kids to be stronger and more muscular, we actually have more appropriate ways that we need to train youth, because in one sense we're trying to get them to think about exercise and physical activity as a normal part of their life. So that's one of the things that ACE is going to recommend that you do. So on page 656, Wolf's Law, which is just a standard issue related to bone remodeling, right? Bones will, when you put them under stress, they'll become increasing in density and they get stronger, right? So that's Wolf's Law. Bone strengthening occurs when bones are acted upon by forces to which they are unaccustomed. It's called bone remodeling. So bones are constantly losing, and they are catabolizing material, right? Cells, and they are osteoblasts and osteoclasts are both catabolizing and anabolizing, right? Anabolic reactions. And the more you have anabolic uptake of cells within the bone itself, you're going to have an increase in bone mineralization. Remember, there's the organic component to bone and there's the inorganic, right? Anabolism, catabolism refers to the organic, the osteoclasts and the osteoblast, right? So those are living tissue. However, when there is an increase in stress on a bone, there's also a response or adaptation, and the body then incorporates more minerals into the bone to harden it and give it more structural integrity. So table 14.1 are examples of physical activities for youth. So there's moderate intensity type training, more vigorous, and those are your classifications. Preschool age, school age, and then adolescence. And then one thing you'll probably see that you won't see anywhere else is this idea of bone strengthening. So anything where there's jumping and pounding, for instance, those are helpful and effective to put stress on the bones, particularly the ankles and the lower leg. And there's a compensatory component to this when you have kids, youth, doing this training, right? And you can strengthen the entirety of the skeleton. Excuse me, something you definitely want to be doing with kids at an earlier age. And so that's what you're dealing with youth. Now, again, it's basically a simple couple of pages. Boom, that's what we would do. The IFT model works because you're going to be basically doing very similar activities. You're not doing one rep bench press with them. That's just obviously not what we're interested in. We're trying to make things fun. We're trying to get them to think more about exercise as a regular activity, cardio exercise, strengthening their CV system and their cardiorespiratory system, exercising so that they can build and develop bone density. These are the things we're actually more concerned about than anything else with youth. Now, here are some recommendations then on table 14.2, the FIT principles: frequency, intensity, time, and type. And right, so exercise for women during pregnancy and postpartum. Now, here we moved into an issue that has some interesting variables to it. Physiological changes during pregnancy. There's a number of things that happen physiologically, hormonally, in particular. Excuse me, when a woman gets pregnant. One of the first things that happens is that the hormones that are released actually create a laxity in the joints, so that the joints actually get more lax. There's a increase in potential range of motion, and so you have to be very careful, especially when you're doing extension movements that could potentially create a problem because of this joint laxity. One of the first things you learn is, because remember, what ultimately has to happen, the baby has to come out of the birth canal, so the hips and the pelvis and all of those joints have to be able to kind of separate and move and expand to accommodate the movement of the baby through the birth canal. And so what the body does basically is it secretes hormones, particularly, and there it is, relaxin. It's a great name for a hormone that creates relaxation or laxity in joints and allows those joints to ultimately, at the end term of the pregnancy, for the baby to push through and allow for the joints to accommodate that without causing damage. And then postpartum, the joints will then get normally back into pre-pregnancy conditions, so that they become more taut and tighter. Okay, so that's one of the issues that you face. Think about, as a woman starts to develop um, a protrusion in the anterior part of their body. Now we have a center of gravity. You never think about it like that, but as a woman starts to show, her center of gravity changes. So when you're training, it's one of the things that you really, again, it's interesting. You just got to keep these things in mind. There are very standardized exercise guidelines for women during pregnancy, and every woman is different, of course. But these are the considerations that we have to consider, and that what you're seeing on page 661 um, are some of the issues that you may see or that a woman may demonstrate during pregnancy and training. So, vaginal bleeding, regular painful contractions. I mean, I remember my wife with our first kid. She started to go through like this preliminary contraction of the uterus, and it is painful. Ladies, you know this. Guys, you don't have a clue. Okay, so painful, regular contractions. The uterus, as it accommodates the growing child, that becomes a big muscle. It's a muscle. The uterus is essentially a muscle, and that entire muscle contracts, and it can be very painful. Fluid leakage, vaginal fluid, that would be amniotic fluid, and then the other conditions that could be occurring during pregnancy, right? Either early on or later through it. So you need to be, as a trainer, you just need to be aware of these things, obviously. And they'll say empathetic. Yeah, obviously empathetic through this. But as you come through the rest of this chapter, you're going to notice that, again, there's a little bit more information for pregnant and postpartum than you saw in the youth. And table 14.3, again, gives you recommendations for women. Don't even look at it until you know square in your brain this is very individual based. As soon as the physician, as a doctor, as soon as their obstetrician or whoever they're using says, you're done, you're not training any longer, I just want you to walk. That's it, done. Piece of cake for you as a trainer to know what you're dealing with. But here are some basic recommendations, and these are very malleable, of course, depending on the condition that your particular client is. And now, of course, we come back to the ABC approach. Here's some good conversational information that you'll want to read through on the mover method. Then postpartum exercise guidelines. Got some interesting stuff going on postpartum. And then for ladies, for those of you that have gone through this, there can be some real issues. I know some women that go into very severe states of depression postpartum. Some women develop um, gestational diabetes and other issues that do cause some problems after they give birth. And so these are the things that we want to be very careful about. Again, before you start reading any of this, keep in mind that as a trainer, you are always acquiescing to what the individual's physician is giving you guidelines on. I've never had any issues with following guidelines and having the client who is pregnant and now she's had her baby, she's ready to come back, tell me everything that I needed to do, and it was basically, I feel good. Let's just make sure we take it nice and easy. Remember, the joints are still trying to get back to their pre-pregnancy state. So you got to still be very careful. Women can feel really strong, and the muscles are very strong, but the joints, they're not ready for all of that heavy or heavier type of training. So you got to be very, very careful. And now, of course, you do have some information on actual exercises. So they give you a couple of figures here. Take a look. It's not a bad idea to kind of get a look and understand a little bit more about some of the sample exercises. Exercise in older adults now. Okay, so we have the youth, pregnant, postpartum. Now we look at older individuals and what are the physiological changes? Obviously, loss of lean body mass, loss of physical capacity, or a decrease in physical capacity, structural changes, right? Stability. This is one of the biggest things. This is why when you're going through your balance and stabilization chapters, keep in mind one of the most important things you're ever going to do for older adults, and again, there's this wide range of not only age issues, but people at the same age have very different physical capacity capabilities, but balance and stability and flexibility, those are really really important. That may be some of the most important stuff you do with your older clients. And then again, how do we apply that? You can read through table 14.4. Again, here are your recommendations for the aerobic resistance and flexibility. I will say this: be very, very careful, be empathetic, and make sure that you are well aware of the conditions that affect individuals as they get older, not just the physical, but the psychological and the emotional state that individuals might actually be in. And it can be very, very difficult for some folks to go through training scenarios and not be able to accomplish some of these most basic guidelines, recommendations, and that could cause some issues and discouragement for clients. I've had some older clients who I had one woman in particular. She was in her mid to late 70s, who just she couldn't even pedal for very long on one of those mechanical bikes. A year later, she was doing that bike for about an hour. The adaptability of the human body at any age is remarkable, and boy, it just gives it just gives me it makes me feel really drives the passion to help people, especially older individuals who basically say, well, I can't, look at me, I can't do anything. Oh, no, 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 no. You got to get training, you got to do cardio, and you got to do the resistance training. It's critical, critical that you do it even at these lower levels of intensity. So chapter 14, that is going to be it. Remember to read your summary, and then I will see you on chapter 15.